You need to bring or wear shorts, just in case I end up in a court of law. I need evidence, okay? It's hard enough to palpate things naked, on skin. Can you even imagine how hard it is when you start to add layers of clothing? And are we getting as much information about our patients as we really can if you keep the clothing on, okay? So you need to have shorts for the next 3 labs because we're doing the lower extremity, okay? All right, so here's the hamstrings. Stop sharing. I'm stopping. Back to here. All right, so here's the hamstrings. What did we say? Ischial tuberosity. You actually have a medial hamstring. Where am I going to?
To the
Medial tibial condyle. And then I'm going to leave the ischial tube and go over to the fibular head. And see how I guessed correctly? Yeah. Okay, perfect. Yeah. All right. And then the gluteus maximus, you said sacrum and ilium, posterior, right? Mm-hmm. Over to the proximal femur. Yeah, can y'all see how this would extend the hip as well? Yeah. Yes, okay. All right, so now, Ricky, slide over towards me a little. I'm going to use the powers of palpation. I think his ischial tuberosity is there somewhere, okay? And there's his fibular head, but let's just make sure. Bend your knee, okay? And I'm actually feeling his tibial tuberosity without making him move, and I know that I'm on the medial condyle of the tibia, all right? So if we wanted to represent the hamstrings, ischial tuberosity to the fibular head, go ahead and lift your thigh. See how I guessed right? The hamstring, the band is on slack, okay? Mm-hmm. And you know what? I'll get over it. And ischial tuberosity to tibia, medial condyle, okay? And go ahead and lift your thigh. If I guess correct, the band goes on slack, okay? That makes sense? Yes. And then go ahead, relax. And now for the gluteus maximus, PSIS, I know the sacrum's in between, okay? And can we all say that's his glute? All right, go ahead, lift your leg. Can you see how I guessed correct? The band goes on slack, okay? Relax. Now, if I want to palpate the hamstrings and the glute, I may have to do this twice because my hands aren't big enough, okay? Maybe I could do this. What's the direction of my resistance?
Flexion.
Correct. Okay? Another way of saying that is what's the opposite of extension? Flexion. Okay? Learn your movements in pairs. It's going to help you immensely. Okay? Now, I'm going to put my hand here. This is my resistance hand. I would be standing over there. What I'm doing right now is a back injury waiting to happen. Big lever arm. Okay, lots of strain, but just for the sake of demo, so you can see what I'm doing, okay, or actually, all right, Ricky, I'm going to have you lift your thigh up. The first time, no resistance, but you can't tell, okay? Go ahead, lift up, and I can feel the glute underneath my fingers and the hamstrings underneath my thumb. This time, I'm going to give a little bit of resistance into flexion. Go ahead, slowly lift up. Ricky, tell them how much I'm pushing.
No, not too much.
Not too much. baby bear, maybe a hair more. Go ahead up, and I mean a hair. Okay, I feel it good and strong, so there's no need for me to give a lot of resistance. These are very superficial muscles. Sciatic nerve innervates the posterior thigh. The glute, the gluteal nerve. Say it 12 more times. All right, got 11 on your own. All right, good. Go play. Little quicker swap this time.